Good day everyone, I am Leomy Villana from BSN 1201 and for today I will be demonstrating or I will provide a special oral care for an unconscious patient. So the first thing to do is to introduce self, identify the patient's identity, and explain the procedure to the client. So make sure that you are talking to the client even if they were unconscious. It's important to talk to the client even if they were unconscious. So, good day, Sir Villena. I am Nurse Leia and I will be your nurse for today. So, for today, sir, I will provide and I will do an oral care for you to be more comfortable and also to check if there's any signs of lesion, swelling, inflammation, or redness in your mouth. Okay, sir? And then gather all appropriate equipment. So, our towel, the basin, the water, the 10 ml syringe, the toothbrush, the padded tongue, the pressor, the soluble moisturizer, and our basin. And then, provide privacy to the client by drawing the curtain or closing the doors. So, we are providing privacy and also showing respect to our client. And then, wash hands and apply gloves. So, observe other preventive control measures to avoid the spread of microorganisms. Then after that, position and prepare the client. So, Sir Villena, I will now position you in a side-lying position with the head of the bed lowered. So, the head of the bed lowered. And now, sir, I will position you. So, I will just cross your arms and cross your legs. Okay, sir, I will assist you in 1, 2, 3. Okay. And then, after that, place a towel under the patient's chin. So, place a towel under the patient's chin. And place the basin under the patient's mouth. Place the basin against the patient's chin and lower cheek. And then, we will now wash and rinse the mouth. So, brush natural teeth and wash artificial teeth. So, in our case, the patient has all natural teeth, so we're gonna brush it. And then, after brushing the mouth, rinse it using 10 ml of water or an alcohol-free mouthwash. Okay. So make sure that the water is running all over the patient's mouth. And then after, suction the fluid if needed. And then, after suctioning the fluid, just repeat rinsing the mouth until it is free from dentifrice if used. And then, what we're gonna do now is to inspect oral tissues. So, inspect oral tissues. Okay. And then, if the tissues appear dry and unclean, clean it with moistened foam swabs and cleaning solution. Okay. Okay. And then, using moistened foam swabs, wipe the mucous membrane of the patient. So, wipe the mucous membrane of the patient. Okay. And then, discard the moistened foam swabs and use a fresh and new one to clean the other area. Okay? And then, clean all mouth tissues using a different or another moistened foam swab. So, always use different and separate applicators. Okay? And then, Observe the mouth and the oral tissues of the client for inflammation, redness, and swelling. Okay? And then, rinse the patient's mouth. Okay, rinse the patient's mouth. Okay. And then, ensure the comfort of the client. So, remove the basin and dry the patient's mouth using a towel. Okay, and then position the client in a comfortable position. So, sir, I will just bring you in a comfortable position. Okay, 1, 2, 3. Okay. Okay. And then, after positioning the patient in a comfortable position, use a water-soluble moisturizer to lubricate the lips. Okay. And then, wash hands and perform hand hygiene to reduce the spread of microorganisms. So, remove the gloves first, and then wash and perform hand hygiene to reduce the spread of microorganisms. And then after that, record the procedure done to provide an accurate data. Okay, so thank you, Sir Villena, for letting me assist you for today. So that would be all. Thank you.